Hello, shalom, and welcome to Friends of Yad Sarah's webinar, Yes, You Can, Making Aliyah with Disabilities. During this special webinar, panelists will discuss their considerations that go into making Aliyah and the solutions and assistance that Yad Sarah and Nefesh can offer people with unique challenges or their families. I'm Michael Miller, a very proud board member of Yad Sarah, and Yad Sarah is Israel's largest volunteer staff nonprofit organization, providing a wide array of compassionate health and home care services for people of all ages, with special programs directed at support for older adults or for children and adults with disabilities. There are over 110 Yad Sarah branches working to improve the lives of the people of Israel throughout the country. Every year, thousands of North Americans make Aliyah. Nefesh B'Nefesh is the singular organization that helps North Americans throughout the entire process of making Aliyah, from pre-Aliyah planning to well after moving to Israel. Over 65,000 North American Olim have made Aliyah with Nefesh B'Nefesh. And it's now my pleasure to introduce our panelists. And before we begin the program, I'll have just a few housekeeping matters to discuss. But let's introduce the panelists first. Eileen Greenspun. Eileen is a new Olah, having moved to Israel as recently as this past November 18th to be exact. Eileen's husband lives with MS. After living their entire lives in Staten Island until now, Eileen and her husband found Israel to be the right fit, and they made Aliyah as a couple. Shani Rosenfeld. Shani is the director of Yad Sarah's exhibition centers. She is an occupational therapist who started in home care, working with stroke patients and home modifications for Kupat Cholim, and now works for Yad Sarah. And finally, Miriam Naiman. Miriam is the senior advisor in the Nefesh B'Nefesh Answers and Advocacy Department. She has helped thousands of Olim integrate into their new lives in Israel and has tremendous experience in helping Olim navigate the special needs and healthcare systems in Israel pre and post Aliyah. As I said, there'll be a few housekeeping notes. One is on the bottom of your screen, at the dashboard on the bottom of your screen. You should be able to see a button that says CC Live Transcript. That's for closed captioning. If you're in need of closed captioning, please click on that button, and there'll be another button that'll say Show Subtitles. And once you do that, you'll see subtitles on your screen. And if you're in need of closed captioning, please take advantage. Also, there's on your dashboard at the bottom is another button that says Q&A. So if you want to ask a question, please ask it using the Q&A button as opposed to any of the other buttons at the bottom on the dashboard. Thanks very much. So let's begin. Let me first ask the question of Eileen. Eileen, what are some of the unique challenges a person faces when making Aliyah? How does one's personal challenges impact the entire Aliyah process?
Well, what we found was absolutely necessary was an extraordinary level of organization. Every document had to be saved, every email had to be saved, and we had to make certain before we left that my husband's medical needs were as well organized as we could make them. He left with 3 months of medication. So we knew we would be safe when we got here. We got letters from all of our doctors. I'm trying to think of anything else. We got power of attorney so that he's quadriplegic now, and we had to make sure that that was in place. So all of these pieces, all of this level of organization was required. And we really found help by reaching out to everyone that could conceivably help us, and some who surprised us by being helpful without our even expecting it. So the big challenge was to remain organized, to save every email, because you never knew when you were going to go back to that for help.
Thank you. Thanks for a very detailed response. So let's turn to Miriam at Nefesh B'Nefesh. So how does Nefesh B'Nefesh work with someone with disabilities or families of people with disabilities in making Aliyah? Again, I'm curious as to whether Eileen, one of your first calls was to Miriam or to Nefesh. So Miriam, why don't you answer first?
I would say that I met the Greenspans many months before they made Aliyah without actually having met them. There were many emails, which then turned to Zooms, because it's always nice to be able to have a more personal connection. And when you ask what can or what does Nefesh B'Nefesh do, I would say that one of the most important aspects of how we can help an individual make Aliyah is to give them food for thought. Sometimes when you are living in your country of origin and you're able to maintain your needs with the resources that you built perhaps a year ago, 10 years ago, 50 years ago, you don't think about the importance of having to rebuild some of those resources and how to turn and where to turn. And some of the first steps before collecting a document might be really to think of, how do you see yourself living in Israel? I would like to share an experience that Eileen shared with me when I went to go drink a l'chaim in person with the Greenspans. And she asked me about taking a taxi, a handicapped taxi that would have a lift. And there was somebody local. And I said, well, just call this local person. I've seen them, you know, that they have a lift and everything that you need. But at the end of the day, that wasn't really a very good idea. The driver was not particularly adept in managing her husband's need. And that's an example of just what Eileen said. They tried to connect all the dots prior to their arrival. And so on the bigger side, in the big picture, they knew that there were no holes left. They knew that all of Ira's needs were going to be met. But on the smaller scale, there's still some bumps along the way. And the more secure you can feel in the bigger picture, sometimes the more sort of flexible you can be with those bumps along the way.
Oh, thank you very much. Is there like a memo that you produce, some document that you produce for people with like a checklist of things that need to be done that somebody with disabilities might be able to reference?
I really like to look at each person as an individual. And so if there are some checklists, which I think is a very cold way to look at something, but yet it allows someone to look at a to-do list. So I understand that, but not everybody's needs are the same.
Right.
So yes, I personally have things for people to think about depending on what the need is.
Thank you, Miriam. So let's now turn to Yad Sarah and to Shani. Shani, what services can Yad Sarah provide to Olim with disabilities or to their families before making Aliyah and after making Aliyah?
Well, frequently, I receive an email from families who are looking, which happened with Eileen, where they're saying, we're considering coming to the country. What ideas do you have? I tend to write a very long email asking a million questions. And I write with the same email the kinds of equipment and the kind of services we offer, which is like home modifications of general equipment until their lifts arrive. We talk about our van service. We let them know about the emergency alarm service and a lot of the other, I'll say, background information, like if they've had a helper, how to look for a helper, who are the nice companies, where are the easier neighborhoods. We sort of talk to each family individually, and that might also be as a tourist would come too, because some people come on a pilot trip. So we'll go any way families want.
And that's across the country. As I mentioned in the intro, there are 110 Yad Sarah sites.
We have a lot of branches. It doesn't mean each branch can do everything. I usually, because I'm a major English speaker in Yad Sarah, feel comfortable talking to the families at first, and then we can give them the information of which locality might have what they need, or if it can be planned ahead of time and they'll get it, not have to go to their local branch.
Okay, thanks, Shani. I'm going to ask a question now of all three of the panelists, starting with Eileen. We'll go in the same order, Eileen, Miriam, and Shani. If someone with disabilities or her or his family is working on making Aliyah, what educational and practical resources should they know about before making that decision? Eileen, do you want to start since you went through the experience yourself?
I think, first of all, and I must say about both Miriam and Shani, that their organizations were directly involved in our success, in that Miriam escorted us through myriad details. Shani arranged, well, actually Rebecca Palmer, the Beit Shemesh person, because we're fortunate enough to have a branch here, assisted in getting a hospital bed, a Hoyer lift, a seat for my husband delivered before we got there, because we arrived on a Thursday night at 9 o'clock and our lift came 3 weeks later. So all of these, you wouldn't think, gee, you need a bed. Yeah, of course you do. But we really reached out to as many groups as we could. And actually, Facebook has an enormous number of resources, so that there is one website that deals with medications and has Anglo support. We are not fluent Hebrew speakers. There's the webinars that Nefesh B'Nefesh has that you can go back to and look at, and locating the resources at your own place where you decide to live is really also a critical piece, I believe. So that if you're in Tel Aviv, you're obviously not going to go to the Beit Shemesh source. You're going to have to look for a place that meets your needs. I think that's especially important.
Right, especially important. I would turn to Miriam, and there are a couple of questions that are coming in on the Q&A. Miriam, how long before making Aliyah should whoever you are going to recommend be reached out to in terms of resources? And then there's a lengthy question. The first one comes from Sherry, the second one comes from Shoshana regarding transportation. But let's start, again, focus still on this question of what educational practical resources should people know about, and I'll add, when should they know about it?
I think that a gift of the 21st century is that information is literally at our fingertips. The more one can make use of that information by being proactive, by beginning their own research, even before reaching out to any organization, but to just see what's out there, helps the person own their information. And then they can turn to any said organization to say, I heard this, I read this. How does that work within what I am planning? When it comes to the logistics of Aliyah, there's the planning and there's the logistics of Aliyah. The logistics of Aliyah, which involve the Jewish agency, as many of you may know, Nefesh B'Nefesh partners directly with the Jewish agency for any one person's Aliyah. Aliyah approval comes from the Jewish agency and expires after 1 year. However, when a person has multiple needs, they may feel that they need a longer time to take the time to research how everything will fall into place upon their arrival. So for that, there's no time frame. On the other hand, Israel is a dynamic country and things change all the time. If we talk about a medication that might be covered within the Israeli medical basket, it may not be available today, but it may be available tomorrow. And that's why it's important to keep on researching and cross-referencing perhaps what you researched 6 months ago to today. I don't think that there is any time limit on when it's too early. The opposite, I think there are many people who wait too long. They gather their documents, they focus on that logistics, especially in a corona world where it may take longer to get things together. They don't give enough time to respect their own personal needs of the planning that's necessary.
All right, thank you. And I'm going to turn now to Shani to respond to that very same question about educational practical resources that folks should know about when they're planning Aliyah with disabilities or family members with disabilities. But there's also a question that came up on the chat about portable oxygen and stationary oxygen concentrators, especially in the Negev. So I wonder whether you might want to touch on that. We'll get back to transportation a little bit later. Shani?
Okay. Well, I'll go directly to concrete. Concrete should have standard oxygen concentrators that are homebound ones in every branch. If we're a little short in the Negev, if we're saying it's not in Sderot, then there will be something in Beersheba. When we know we're going short, we usually send equipment down more frequently. The portable oxygen concentrators have been flying off the shelves. And I can tell you today, at the end of the day, this morning, there weren't any on the shelf. And I don't know when there'll be any more on the shelf. They've been really being taken a lot for people who are going out. And the local Kupat Holims do not offer, the home health agencies do not offer portable oxygen for the elderly adults who could be over the age of 50. It's not in the basket of services. So when people hear that, they're disappointed. And that's why we have, in many cases, oxygen bottles, the cylinders that people will take until they can access one or buy one or find it from another company, because they are very pricey in Israel. So we tell people, if you're bringing your own oxygen concentrator, let us know which brand you're talking about so we can see if there will be someone who could service it, if it's not, our item. Educationally, I'll just say 1 second about it. There are a lot of good websites in Israel about education. And when families write to us, we try to connect them with type of education they're looking for so they can meet someone who knows about that, as well as social activities. We wouldn't say for someone who's very active, who's going to live in a very, very small town, we will send them the lists of all the social activities and the local community centers so they'll know what goes on there.
Michael, can I add something to what Shani had to say, please?
Sure, feel free. Yep.
That you mentioned about oxygen, for example, if somebody is bringing something with them, I would just like to expand that oxygen might not be a very common need, let's say, for the average OLA. It may be more common than I realize, but it may not be as common perhaps as someone who's diabetic, someone who has an insulin pump. And so I just wanted to sort of add what Shani had to say was that if you have any medical need, it might be your hearing aid, it might be an insulin pump, it might be from A to Z, do not assume that what you have is going to be serviceable in Israel. And when I say serviceable, I'm talking about the necessary accessories or appliances that might come with that. And there was a time that people might have sort of depended on a spouse or somebody facilitating that need country to country. And with Corona, that's not something that we can right now depend on. And also, I just wanted to add about resources. There are so many organizations, there are so many webinars hosted, not only by Nefesh, but by other organizations as well, that are easily accessible.
Okay, that's very important. And it kind of leads into the next question, which is the cooperation among organizations. Miriam and Shani, can you please talk to us about how Nefesh B'Nefesh works with Yad Sarah and Yad Sarah works with Nefesh B'Nefesh?
I could tell you from my position, when somebody approaches me, I know there's a participant today who I had the pleasure of meeting in New York pre-corona, who plans on coming very soon to my community, that it's so important to share with an individual all of the resources that are going to be important in that person's life so that they can then make contacts, pick and choose, and the relationship, just like Eileen had a relationship with Shani, with myself prior to her Aliyah, we sort of just picked up as we were good friends for years, even though it had been months. But that organization now knows what the needs are. And there's such a nice collaborative, streamlined relationship. So Yad Sarah can turn to Nefesh B'Nefesh to say, well, what about this? They need oxygen. How is the flight looking for them? What do they need for the plane? This is what they have shared with me. Have they shared that with you? And that collaboration is only to the benefit of the Ole, who also, it's always helpful when that Ole is proactive and making sure that his own personal dots are being connected.
All right. Thanks, Miriam. Shani, do you want to weigh in on that as well?
I agree with everything you said.
Oh, okay. So we're gonna move on to the next question, and I am monitoring the chat. So those who are putting questions in, don't worry, I'll get to them. But I think it's important to put on the table now the differences between those in North America who are accustomed to how disabilities are treated in North America versus coming to Israel. So how is living with disabilities in Israel different than living with disabilities in the United States? And we can really ask that question directly of Eileen. What do you feel is the biggest adjustment? And of course, both Miriam and Shani have had a lot of experience dealing with these matters too. But Eileen, why don't we start with you?
Okay, two things. First of all, obviously the medical establishment in Israel is a different establishment. We never had to be part of a system and work through a system. We're finding though that can work really well for us because there's somebody who's organizing things for us so that we're not going to the wound care doctor here who we really don't like, but we know him. We kind of give our parameters and they try to help us. Also, and I'm trying to figure out how to articulate this clearly. When we lived in America, we built a system that worked as well as it could for us. Most of which was on my shoulders. And what I've found here in the month and one day that we've been here is that I'm really learning to ask for help.
Mm-hmm.
And that asking for help is really incredibly liberating for me and for my husband. We're meeting interesting people we go on our neighborhood chat and ask teenagers to help move our furniture.
Mm-hmm.
And this one says, oh, you need a power of attorney. And by the way, for anyone who's planning Aliyah, make sure you have a power of attorney if your husband is disabled or your spouse is disabled, because that became an issue for us. So somebody said, oh, I know a notary somewhere. And so I find that for us, that both the system and learning to reach out more has been incredibly important. And Miriam and Shani have both been, I can't even describe how helpful. It's just been a beautiful experience, as well as some of the other resources.
Thank you, Eileen. But before I turn it over to Miriam to respond, there was a question in the chat about how your husband handled the long flight from New York to Israel.
I'm happy to answer that.
Please, go ahead.
Okay, the flight from New York to Israel took 12 hours.
Whoa.
The anxiety that preceded it took 2 months. And in fact, the flight was just fine. We were, however, I will say, we are blessed with a wonderful son-in-law who did come back from Israel to accompany us, because there were some logistical issues. But in fact, I wish we had had some more Amuna, that Hashem was watching us and helping us, because the flight was just fine. We got off the plane. Nefesh B'Nefesh had their people there. They welcomed us. They took our luggage. They gave us as much support as could be. We came home. Our entire family was in front of our of where we're staying, and there was our bed. There, it letting anxiety go is for us a big issue.
Yeah, I can appreciate that. Miriam, in responding to the question about the differences between living with disabilities in the US and living with disabilities in Israel, one of the questions in the chat is, what about language translation services or special medical terminology? Can you address that as well?
Absolutely. Just to go back a second, though, before I address that, Israel, for many people, is familiar. Perhaps they visited. It's familiar, sometimes just in their hearts. But the day-to-day aspect of living once you've made Aliyah is very unfamiliar territory, coupled with the fact that somebody may have a limitation of sort, a challenge of sort, makes that lack of familiarity feel even more threatening to how things are going to get done, how they'll be able to access whatever the need is. And most aspects of one's life are affected when you make Aliyah. For somebody with a limitation, the healthcare system might be the most concerning to them. When it comes to translation, nobody wants to feel in the dark when a doctor is talking to them, or even worse, talking over their head. Sometimes doctors tend to do that. We on the Nefesh B'Nefesh website have a full but simple medical vocabulary sheet that a person can find out what I would say are some of the typical vocabulary words that a person needs to know, such as blood pressure, such as a referral, different kinds of things. But then there's an organization, there's organizations like Yad Sarah, there's an organization like the Shira Pransky Project. There are private healthcare consultants that a person can turn to get them started, by going to doctor's appointments with them, by coordinating appointments for them. It's very hard in Israel when you go to the doctor and he says, see this specialist, that specialist, get this imaging taken care of. He doesn't then tell you which specialist to go to unless you ask, and he may say, I work with this particular person, or he may not, and say, just find out who you want to go to. And that's where being proactive, Eileen said herself that more than ever, she's being independently proactive in asking for help. And that's really important. It's important to respect the concept of time when you make Aliyah. So yes, when you have a healthcare need, you don't feel that you have time. On the other hand, the more patient you are with yourself, or you reach out to others to say, what does this say? I got this from my doctor, or my doctor told me I need to schedule X, Y, and Z. Can you help me? Will allow you to breathe and to not feel as much anxiety.
All right, thank you. We'll turn now to Shani, and while I'm asking you the same question about the differences between life in the States and life in Israel regarding disabilities, a question also came in about consulting Yad Sarah regarding whether or not to buy a new drive power wheelchair for Aliyah in April. You probably know more about those matters than I certainly do, but maybe the other panelists. So Shani, why don't we deal with that? And I don't want to skip over the transportation issue. So let's start talking about transportation too. Again, turning it to Shani first.
Okay, transportation in general, we have just started the tourism service that will help people with their transportation and their regular equipment services. During COVID, because we didn't have many tourists, there was on the website, it didn't exist, but if you go on the English website, it will say Tourist Services Yad Sarah, where transportation and the vans are discussed. The whole concept, and I'll just say one thing, I said to Eileen a few weeks ago, I said, Eileen, you're no longer in Kansas anymore. and it's okay, it's different. And sometimes rules make no sense. And we always say, and I really appreciate what you said, Eileen, and what Miriam said, you always ask your neighbors, your friends, all the different groups, because you learn a lot from a lot of different people. There was at one time, we had a few volunteers who would actually help people talk through their doctor's appointments. That has kind of slowed down because of COVID, that some of these people are no longer feeling comfortable doing that. The whole concept of, wait a second, I just lost my train of thought. There's one thing about equipment. I always say, and Eileen, you had that problem when your transformer blew. We have a lot of CPAP machines that we say to a person, you're traveling, you blow your transformer in the hotel room. We have others. We would say to a person who uses a power chair that I would gladly have a conversation with them. And my email will be on the page afterwards. And we'll talk about which companies are very popular here, where I can find the same brand of equipment that they are purchasing. But once you leave the country of purchase, you will not have any guarantees of service. You lose that period of time. The companies in America will not guarantee that the Israeli same brand will continue on with that warranty. That doesn't mean you won't get servicing, but you'll be paying for it. And the concept of what you really like for equipment. So I will gladly talk to that particular person. We can have a private email conversation, and I'll give them, what's around here. That's the brand that they're looking for.
Okay, Shani, that's a good segue. If you feel comfortable, you and Miriam, to put your email addresses into the chat, only if you feel comfortable, feel free to do so. But a question just popped up on the chat, on the Q&A, which is where it should be, Shani, and that's about scooters and supermarkets. We talked about transportation a little bit. Why don't we talk about shopping?
Okay. We all love to shop, although in Israel, we have become very popular using the internet, a lot of grocery stores, a lot of companies, there are a lot of online shopping. Scooters are not sitting like they are in Walmart or Target in each of the grocery stores. There is a very big market of small scooters that people are purchasing. Sometimes we have them in lending for a short period of time. They're against the law to be on the street. They're supposed to be on the sidewalk. They're popular, but you have to be very careful using them. I'm trying to be as politically correct, but also to have people safe as possible, because Israeli drivers make New York drivers look very safe.
Okay. Thanks, Shani. Miriam, another question in the Q&A. Will a full disability allowance be continued after Aliyah for a pensioner? And will there be an assessment from Bituach Leumi?
It's an excellent question. as Shani said, how she said to Eileen, you're not in Kansas anymore. There's a lot about living in Israel that's really not like Kansas at all. When it comes to one's disability, a person's disability is not changing over the ocean. Israel looks at general disability up to the age of retirement, which is 62 for a woman, 67 for a man, slowly growing to 64 for a woman, but not yet. After the age of retirement, because one is not able to be grandfathered into a system because they weren't born here and grew within the system with their disability, or they weren't diagnosed with a disability under the age of retirement to be grandfathered once they hit pension age. What they are potentially eligible for, please notice potentially is underlined, is something called Chok Siyud, which is elder care, which is something offered through the National Insurance Institute, which allows somebody, for example, to get assistance with a subsidy from the national insurance, from the Bituach Leumi. This is one of my specialties at Nefesh B'Nefesh, and so that we don't monopolize the conversation, if this is something that somebody would like to discuss, I've put my email in the box and someone can happily discuss that with me. Something that Shani said and that Eileen said, I hope that it'll allow me just to add here. If you are coming with accessories such as a scooter, such as a wheelchair, such as a car that's outfitted for your needs, please do check with either myself or your Aliyah advisor at Nefesh B'Nefesh, just to make sure that your appliance will not cause any need for any extra customs. You might say, but I need this. This is for my well-being. And most often that's fine, whether it's one wheelchair or two wheelchairs, or sometimes even three wheelchairs, depending on the need. But there are other appliances that, yes, it could be seen as problematic, and we've had that experience. So again, as I said earlier, never assume.
Yeah, thanks. Eileen, what is really the largest, the biggest challenge that you faced with your husband and planning to make Aliyah? What do you think was the probably the most daunting challenge that was before you?
Apostilles.
Well, that's every Ole.
Because for us, and I think I mentioned the issue of power of attorney, I think that we really did get support, and but there was a feeling, you know, it's a big move. This is not, you know, we ain't in Kansas anymore. You're right. And that challenge of making sure that we crossed as many T's and dotted as many I's, and then kept finding that there were still more I's to dot, made the previous question about the flight. We made a phone call to United Airlines, which we flew, and they have a special person who deals with disabilities. I think one of the biggest challenges that I faced as the one who organized all of this was not screaming at people. Being told Israel is a very bureaucratic system, and we went during COVID, and just not letting anxiety take over and just trying to be rational at all times, which I would hang up the phone, and I admit to crying a few times, but just saying, we're not going to let this beat us. We're going to climb that next mountain and do the next thing. And then I would call Miriam, and she would say, you know, don't worry, we're going to do this and do that. And just feeling trying to just always view it as going step by step. And some of the questions that people are asking are, you really have to have faith that you're doing the best you can do and that there's not the right answer out there that somebody else has that you're missing. You're going to keep going. And if you have to change the path a little, that's fine. Documentation of disability. Somebody asked about that. And I know somebody had said something about fingerprinting. For my husband, who's quadriplegic, he couldn't be fingerprinted by the FBI.
Hmm.
We had to document that, and we did. That didn't mean that the next people, that the Jewish agency didn't want proof that he could. So it's always, it's a challenge, and you just have to have faith. We're here. We made it. Ira is quadriplegic. He runs his motorized wheelchair with his chin.
Hmm.
And we brought a new wheelchair with us because we wanted to make sure he would be able to get around. And our van is coming in a few weeks. And I don't know whether you could see the boxes still behind us on our lift, from our lift. Really, the biggest challenge is saying, okay, this is what we're going to do. Anxiety is not going to rule, is not going to keep us from this. And if it takes, our daughter made Aliyah 2 months before us. We had originally planned to go together. It didn't happen. But we came 2 months later, and we're here. And there's a beautiful blue sky, was a beautiful blue sky out there today. And I didn't need my down jacket. It's a little chilly. So you got to have faith and go step by step. That's all. And I just wanted to add one thing. Translation, if you have someone who can translate for you, it really does help. We have a daughter who's been here for several years. She helped a lot. She set up with Yad Sarah. So if you've got anybody you can reach out to who can help you with that translation, I think that is something to really look for if it's hiring someone or whatever, to get somebody who can really assist you with that. That's
Thank you.
about it.
Thanks so much. You put a lot on the table, and I'm sure everyone's appreciative of that. So thank you very much. We're running out of time, and I want to make sure that I put on the table as many questions as I can. So I'm going to go back to Shani. The question again around transportation. Can transportation be arranged for daily intercity trips as needed? If, let's say it's for work or for study or for a medical need, again, transportation intercity.
Okay. What there is there's a variety of different organizations, not just Yad Sarah, that offers transportation. With Yad Sarah, it can be the last minute. It's usually planned ahead of time, that if at least a week ahead of time, you can give them your schedule and they can see if they can fit you in. For medical appointments, there are a few other organizations, and depending on which medical issue someone's dealing with, if it tends to be cancer, there are free rides for people with cancer. There are other services that if you can't get down your stairs because Yad Sarah is expecting someone to be on the street level, there are even other organizations that offer ambulance or people to help you get down the stairs. So it depends on who, what, where, and how. With Yad Sarah, we are subsidized, so we are considerably cheaper than the private taxi services who you see on the street. That's a regular taxi van. There are people, and we really didn't discuss, we were focusing in on Eileen's, but we have families with children who are school-age children who are entitled to transportation to their schools, and that's a whole nother kettle of fish. We also offer van services for vacations. People can either take a driver And some people who are going down to Eilat this weekend for a vacation. So it varies according to what the need is, where the person lives in the country. And now that wedding halls are opening up, there are also just for social things, even late into the evening.
Thanks, Shani. As I mentioned at the top, as a proud board member of Yad Sarah, I have to say that there's so much which Yad Sarah does for people in need. And if you're so inclined, our participants, our viewers, to make a contribution, I'll ask my colleagues behind the scenes to drop into the chat the donation link. So please do that, Adele, Jennifer, someone. Thank you. And now I'm going to turn it over to Miriam about how long Nefesh B'Nefesh stays in touch with Olim after they get to Israel. I know a little bit about this, the answer to this question, but I'm going to pose it anyway. It's on my list.
Till 120.
Amen. Amen.
It's a little bit more intensive in the first year because that's when a person is remembering that they had figuratively their own 2 feet to stand on. And what we try to do is by the end of that first year that they are feeling secure in enjoying their life in Israel. But we have people calling us who made Aliyah even before Nefesh B'Nefesh was established because life happens and life cycles happen. And there's always something new that life brings us. And it's a wonderful resource I didn't make Aliyah with Nefesh B'Nefesh. There was no Nefesh B'Nefesh when I made Aliyah. And had I had a resource to turn to for so many of my questions, my Aliyah definitely would have been different. It might not have been easier for certain reasons, but it might have been a lot smoother.
Miriam, a question just popped up from Leo. Is there a special tax on bringing in a modified handicapped accessible van?
So the answer to that is no. Bringing in a car is bringing in a car. Whatever is inside the car that has made it accessible for you is really not particularly relevant. However, if you're going to then need a license because you're the one driving the car, please be in touch with me so that I can walk you through and help you set your personal expectation of how quickly you'll be able to get to get your foreign license converted. And if you're going to rely on public transportation until that point, because I know that somebody wrote to me prior to today to mention about public transportation, many buses are handicap accessible. But that doesn't mean that all intercity buses are handicap accessible. Shani is nodding her head yes. And it can be very challenging. And even if the buses are handicap accessible, the sidewalks are not always handicap friendly.
Right.
Because of lots of reasons. And these are the smaller details that when I spoke in the beginning about your big picture to be very secure, there are some ups and downs of learning to live in Israel that one should expect and how to overcome and how to work through some of those challenges.
Great. One additional question, Miriam. Is there anywhere to find information on accessible communities and housing accommodations?
I would like to defer housing accommodation to Shani.
Okay.
And in terms of communities, I think the topography of a community is very important to keep in mind. Israel at large, Begadol, is we're mountainous, but there are those areas that are flatter. It could not be the topography, but it could be the climate that really is a not healthy trigger for you if you have asthma or whoever you are. So that's really important to keep in mind. But when it comes to modifying a home, Shani, I defer to you.
There are a lot of different services related to modifying a home. Some of the equipment we have can help you if you're in a rental because you can't tear down a wall or make a doorway wide enough. But there are also, once you become a citizen of the country, there are certain services that the home health organizations offer that a therapist can come to your home and actually go through the process with you to decide if you are entitled to any government funding for a modification. We always say where the first place you're going to live is not necessarily the final home you're going to be in. And I agree about Mass, but even in mountainous, 2 or 3 stairs can be a challenge, just like someone with, an area that's a beautiful area with gorgeous gardens, but if you have a vision problem and there are not many lights in that area, that's also a challenge. So we try to give people ideas of what other accommodations they can find or consider as their temporary. So if anyone would like to write, we'll gladly give information, but I do not have a list of 25 accessible apartments.
But Shani, it goes back to something you said earlier about the importance of community resource, and everything that a community of choice might have to offer you.
Yeah, and I think Eileen spoke to that as well, and that's exactly what I want to do, give everyone an opportunity for a last word, just a very brief last word, but I believe that Eileen has moved into a community that certainly appears in Beit Shemesh to be very supportive. So Eileen, one last word for our audience, so to hear from you.
Come on down. Come on down. It's just, you have to, I think that knowing where you're going to be and having a place that's safe, feels safe for you. Because as I don't remember whether it was Miriam or Shani said, if you're blind, you're going to have certain needs. There are buildings that have elevators, but you have to take steps to the elevator. You have to find the place that meets your religious needs on a certain level, that meets your, there are the same things that everybody who's not dealing with a disabled person needs, and the place that will allow you, like the place where we're coming in through the garage right now, because that's accessible, and we're going to work on changing that. But I turned off my phone. Sorry.
Thank you very much, Eileen. I'm going to turn over to Miriam. Last word.
This was entitled Aliyah, Yes You Can. And regardless of my involvement with Olim for over 20 years, I would say that yes, everyone can, with the proper research, with making sure that what they need awaits them in Israel, in the community that they've chosen. And that would actually be my final word. I welcome you to be in touch. I welcome you to explore. I welcome you, if you're further along in your process, cross those T's and dot those I's, because there'll be more T's and I's that await you. And don't hesitate. The more you communicate with all of the organizations that you have turned to, the more secure you'll be.
Thank you, Miriam. And now to Shani.
We're ready. Anyone wants to come, thinking about coming, we'll do our best. We don't ever guarantee perfect. And we also like to work with all other community organizations. So when someone asks us about children, we'll send them to a special group of parents who are dealing with children. We just will try and help everyone who wants to. Don't hesitate to call or to write. We're sometimes a little slow. Give us a day or two, and we're also on the wrong time zone. But we're available, and we'll like to talk to anyone who wants to talk to us.
Thank you. And my last word is thanks. Really, a very warm toda rabah to Eileen, to Miriam, to Shani for spending so much time with us. Thank you so much to our audience for viewing, for being so engaged. We've had so many questions coming through the chat, and even one in the chat, and many of them in the Q&A where they should have been. And Please stay tuned for upcoming webinars this coming calendar year in 2022. My greatest thanks are to the organization that has sponsored this, Friends of Yad Sarah, and of course to our friends at Nefesh B'Nefesh, and to the Ola and Ole, to Eileen and to her husband for doing exactly what Shani just spoke about, and Miriam spoke about as well, just coming, being prepared and coming. They've done it, and others can do it as well. Toda rabah to everybody, shalom, and look forward to seeing you again on another Friends of Sarah webinar. Bye-bye.
Bye-bye.